So let's talk today about the differences and costs of healthcare versus sick care. So some of you may be wondering, well, what is healthcare or sick care? Aren't they the same thing? Well, let's talk about sick care. Sick care is what we do in America. That is the standard model of care. It is the model that says if it ain't broke, don't fix it. Then when it feels lousy, that's when you go to the doc. And when you have that symptom, doctor says, here, let me give you a medication. The medication is designed to help you feel better or mask your symptom. The problem with that is that we often feel better, yet it does nothing to correct you or heal your problem or get you better. Well, and so what happens is now we feel good, but the problem continues on, and it doesn't stay the same. The problem often gets worse. We just don't have any idea of what it's actually doing to the body until it becomes worse. So that is the American model of healthcare, but it has nothing to do with health. In fact, when you hear the commercials about going to the pharmacy for all of your healthcare needs, that is an oxymoron. And in fact, we're often moronic if we think that we're going to the pharmacy to get healthy. You cannot take a medication and be healthy at the same time. Sickness is not an entity. Sickness is not something that you get. It doesn't just come upon you. Sickness is your body being at a state of unease or dis-ease. It's not functioning properly, and that creates an environment to exude problems or adaptation to whatever's going on. Whole nother story, whole nother concept for another day, but understand that anytime that you're sick, it's not because it just happens, but there was something that created that sickness or a lack of adaptation in your body. Okay, so now let's talk about healthcare. Your ability to be healthy is based on your body's ability to adapt. Remember, it's your nerve system that controls every vital function in your body, including your health, and its ability to adapt is paramount in order for you to be healthy. That's why when there's blocks to the nerve system, it can no longer adapt, and the body becomes in a diseased state. And so that's why you're getting adjusted to remove that nerve interference, so that you can adapt and heal. So some people are saying, well, I don't know if I can afford this. Healthcare is so expensive, trying to eat right and do all the right things and getting adjusted. Well, understand that here's the road that most people go down, including you, if you don't change your behaviors and change your thoughts. So the majority of people say, if it ain't broke, don't fix it. Then when it feels lousy, that's when you go to doc. We discussed that, okay? Well, here's what happens. Let's talk about just in terms of, I have a lot of people that have gut or bowel dysfunction, irritability, indigestion, or just get a lot of bloating, those types of things. That's a very, very common symptom that patients come into me with. Aside from, the more obvious things like pain and discomfort. So something that you have to understand, a symptom is just your body's warning signal. So if you have bloating, or if you have constipation, or if you have indigestion, or maybe the opposite, maybe you've got, runny or diarrhea, those types of things, right? Well, that's your body's warning signal that says something's not functioning properly. And so what people do generally is they try to ignore it. Maybe they try to avoid certain foods that they know bring it on, or they'll take it over the counter, like what's the pink stuff? I forget. Anyways, pink stuff for heartburn, or they'll take an antacid tablet, or maybe go get a prescription drug to the purple pill or whatever to help them to feel better. And so this goes on and goes on and goes on, and understand that this can start as something very small and very young in life, but it doesn't manifest into the full brevity of the situation until later on in life. Okay, so the person is taking maybe drugs to help manage their discomfort, but again, the drugs, they don't do anything to correct your problem. It just continues to get worse. And then we also have to deal with not only the cost of the medications, but the cost of the emotional toil that it takes, that you say, you're like, oh, I don't know if I can eat that, or hey, I hope there's a bathroom nearby, or maybe you've got to take more breaks throughout the day at work. How does it affect those types of things, those things that are intangible, that we can't really put a price on? Let alone maybe decrease in productivity, whether it's at home or office. Those things are important. And so maybe we go and we pay our $15 copay to the general practitioner, and they say, oh, well, now let's give you a diagnosis. Now it's you've got GERD, or maybe you've got IBS, or colitis. Whatever. They give you a name for it. They give you some more fancier medications, still at your $15 copay, and they say, take this, you'll be fine. They haven't done anything to actually correct the problem, remove it, figure out the cause. They're just giving you a medication. Sound familiar? So now we've got a diagnosis. Yay, we're taking these medications, but it hasn't done anything to fix your problem, because if you took the medications away, what would happen? It still comes back. So that means that the problem is still going on inside your body. There's still dysfunction in your body. Again, you just aren't really aware of it. So it doesn't get better, it gets what? Worse. And we continue on about our daily lives. Maybe we don't even think about our diet. We adhere to the 3 C's. And the 3 C's isn't just only in terms of dieting, but the 3 C's is often in terms of our health care. 3 C's meaning it's cheap, it's convenient, and usually if it's cheap and convenient, that means it's crap. It's crap for your body, it's crap for your health. And so it's very convenient to pay our $15 copay, but you get what you pay for. And so that problem just gets worse. It gets worse. Maybe you don't feel it for a year, 2 years, 5 years. And what I found is that people don't understand, or it slipped away so incrementally that they don't realize that where they were 2 years ago as opposed to now are very, very drastic pictures of what they used to be like. And it just slips away slowly, 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 until now we're having more problems. Now we're getting into the big hitting medications like Remicade. Well, Remicade, a single dose of Remicade varies anywhere from $1,300 to $2,500 for one single dose. Okay, so now we're paying more for prescription medications. And of course, we always, if there's a problem, well, first thing first, they want to do the colonoscopy. And so anywhere from $2,100 to $3,700, these are the numbers today. I looked these up. They say, well, but my insurance pays for these things. Yes, your insurance pays for you to stay sick. And they'll pay for you to have more diagnostic work and have more medications until finally they say, I'm sorry, there's nothing else we can do for you except now it's time to do surgery. And so maybe we have bowel obstruction surgery, or some type of intestinal type problem or crisis. Now we're running into $7,000, $15,000 to $25,000 just for bowel obstruction surgery, and that's not including the time spent after the surgery, time in the hospital, any infections, post-op follow-up, rehab. Okay, and then let's talk about the time lost, maybe at your job, or just the quality of life. Okay, so now we're in the tens of thousands of dollars, and you're worried about paying $200 a month, towards preventative care. When we put it into perspective like that, we have to understand that a little bit of time, a little bit of effort now is worth a whole lot more than the pain, the time lost, the money lost later on. And so, what is that worth to you? Do you want to wait until things blow up and then you're paying thousands of dollars to try to put the pieces back together? No, everybody does that. It doesn't work. That's why the number one cause of bankruptcy is actually unpaid medical bills. Do you have $8,000 a month to go into the nursing home? Because that's what a friend of mine is paying for their mom, who can no longer pay because she spent all of her money, went on Medicare, and even Medicare paid for all of the, the procedures and whatnot, and she left her completely broke. She couldn't even be affording to be in the nursing home unless it was for her children. So even if it's not for yourself, do you have that money set aside for your parents? What's it worth? She's sitting in a nursing home paying $8,000, sitting in a wheelchair staring at a wall. How does that sound to you? Is that the future you want to look forward to? Well, if it's not, then you need to start doing something different. You're taking good steps by coming here. Let's do the math. $8,000 a month for 12 months. We're looking over $100,000. $100,000 in 1 year just for cost of living. I don't think our care plans are that much, to be honest with you. In fact, we should be charging $8,000 a month. We're talking about lives being changed, people getting out of wheelchairs, people getting off of their medications, affecting not only lives of individuals, but families and generations. How amazing is that? That is priceless. But we don't want to make it priceless. We want to make it affordable for you. And that's why we have the care plans that we do. And that's why we allow you to pay off in monthly increments if you need to. We're always here to work with you. But understand, health, it is a choice and it is up to you. And you've got to put the effort in. I'm here to help you along the way. I'm going to do whatever I can to help you live out your life in victory, because that is the plan that God has purposed for you. The Bible says, I know the plans I have for you, plans of a hope and plans of a future. And so we've got to be stewards over what we're given. And I don't have all the answers, but I'm going to help you find them along the way if there's something that I don't know. But I just want you to know I love and care for each and every one of you. If you need anything, I'm here for you. But let's talk about health and life and not sickness and disease, and how to reach the plans and the goals and the dreams that you have in your heart so that you can live in victory.